All right, concussion. This is a huge topic. It gets a lot of coverage all over the place, and you should know how to recognize concussion, risk factors for it, and more importantly, how to treat it. So concussions, what happens? Traumatic induced physiologic disruption of brain function with or without loss of consciousness. You do not have to be knocked out to have a concussion. You can literally just have brain trauma with it. So mild traumatic brain injury, post-concussive syndrome, having your bell rung, because I deal with a lot of athletes, you got your eggs scrambled. That'll be another one right there, okay? What happens physiologically is contact results in the brain being sloshed around. So if we look at our brain, it's actually sitting in cerebral spinal fluid in a nice little ocean of this wonderful juice that keeps it all in place and nicely balanced and nutrient oriented and all this stuff. Mild injuries go unreported due to a lack of recognition. So a lot of people get hit. Oh, it's pretty mild. I'll go back out there. There are velocity measuring helmets that you can get that can actually show you what the forces are. And there has been big controversy, especially in boxing and professional football. Those repetitive small hits of the football players, or especially in boxing, result in additive effects over time. So one of the things that can happen is compressive forces that result in direct crush injuries. So this causes like a coup, counter coup, where the head gets rocked back and rocked forward. You can also have rotational forces that literally shear axons. So when you actually look at these injuries in the brain under electron microscopes and stuff, you can actually see, because a lot of football players have donated their brains after death, not before death, after death, for actual analysis in labs. And you can see there is a shearing that happens between different brain layers, and the axons actually get teared. So this is one of the things that people don't realize. You're actually tearing neurons during these injuries. Can be crush injuries, tearing as well. Who gets this? Anybody can get it with physical activity. Tends to be our peak athletic years, but anybody can get it. Males slightly more than females, but again, as you start to normalize the activity levels, you can see it's equal risk factor. For women, it might actually even be a little bit worse. There is a correlation between neck size and severity of concussion. As you have a thicker, stronger neck, it is harder to get concussed. If you have a smaller, thinner neck, the symptoms often are worse. Pre-concussion, previous concussion is the number one risk factor. Once you get it, you are predisposed to a sensitivity in that area, and it increases your risk by about 3 to 5 times. You see multiple athletes. I can remember one from when I was a kid. Eric Lindros was going to be the next Wayne Gretzky all-star player for hockey, and he started getting concussions, and it just went downhill from him from there on. So high impact injuries in sport, car accidents, even physical assault. Why I like Brazilian Jiu-Jitsu and not, because I've done a lot of boxing, kickboxing, stuff like that, karate, is there is the chance for those high impact injuries. And if you have people in Jiu-Jitsu who know what they're doing, it's a slow movement that still develops martial arts skill, but doesn't result in super fast injuries that you might do that can cause the actual concussion to take place. Repetitive head trauma is going to be the big one. So, boxing, obviously, soccer's, young kids heading a ball all the time results in shaking of the brain. It can result in more significant trauma. Possible genetic predisposition as well. You may be more predisposed, but again, I would look more at the size of the person. The bigger their neck, the stronger they are. Generally, the harder it's going to be for them to get a concussion. But again, the number one risk factor is prior concussion. Key things to get here. Detailed documented history of concussions and prior injuries need to be noted. Especially if you have a player and it's been like, how many times have you had your bell rung? And they'll be like, well, I don't know, maybe like 30 or 40. Yeah, that has an additive effect over time that you need to be able to verify. The other thing that happens, and I talk about this here, return to play decisions. A lot of players will want to, because they have the instinct to want to get out there and do the best that they can with it. So they'll want to get out as soon as possible back on, and it might be too soon for them to come back. What can lead to this traumatic brain injury can be impact traumas. So this we're showing a fracture, but it doesn't have to even be a full fracture. It could result in a hematoma that causes compression of the brain, car accidents that are acceleration, deceleration injuries, and even shockwave injuries that you might see like in the military. If you've been around, like in the Ukraine right now, we see these big blasts of bombs going off. That shockwave can travel through your body. If you're around heavy equipment like diesel locomotives, that shock wave and vibration can travel through your body and start to shake this tissue up. And again, cerebral spinal fluid, it should be just floating in a nice gel, just oscillating in space right there with minimal force on it. So what else do we see on the physical exam? Confused or blank expression. They may not be able to identify where they are or even who they are if it's really bad. Okay. Delayed visual or motor responses. So you go ahead and shine a light in your eyes, say, track my fingers. They're going to have difficulty with that. Visual changes like blurred vision, disorientation, and then speak. Coach, put me in. Okay. Grandma, coach, go. Okay. You can see that kind of stuff if it's really bad. Dizziness and incoordination. Yes, when you see this, it literally looks like the person can't walk, like they've lost all motor function when they're really bad. Absolutely. Memory loss is huge. They may not remember it actually happening. They don't, what even happened? They'll just wake up and say, what? Like 15 seconds or a minute later, depending on how long or how bad it is. Persistent vomiting, worsening headache, increasing disorientation, changes in levels of consciousness suggest significant brain injury. If they vomit, they need to go to the hospital right away. As these symptoms get worse, they are not in your office. They are not on the sideline. They need to have immediate medical evaluation because you could be looking at other more significant injuries like hematomas, like brain bleeds taking place, severe strokes happening. A simple sideline evaluation is a given right here. That's one that I use all the time. So number one, what time is it? Do you know where we are playing today? Do you know what we're doing? What are we actually, what is your name? Who's the president of the USA or some kind of major thing that they would know, right? Concentration. Can you count backwards? Now, because I do stuff for professional sports teams, and we'd always talk back and forth with the athletic therapists and other people on the teams. And they're talking about a lot of this stuff can be too difficult for even a regular player to do. Can you count backwards by sevens for me from 100? That can be hard for a regular person to do. But if you say, can you count backwards by fives from 30, that should be an easier thing for them to do, right? If you look at the current screens, they are very difficult for people to pass. So yeah, but we'll get into that here in a little bit when we talk about the questionnaires. Memory, can you name the team in the prior match that we played? I'm going to give you 3 words. Tell me those 3 words back, okay? Banana, pajamas, tango. Remember those words, okay? All right. What else? Neurologic testing. What do we see? Decreased strength, coordination, and sensation. Dysdiadochokinesia. Can you take your hands and flip it back and forth rapidly like this? Can you show me good movement of those? That's a fairly coordinated movement for you to do. Usually they do it on their knees, but for the camera, I just demoed for you right there. What else? Physical exam. There may be bruising or swelling. They may actually have rhinorrhea, like fluid leaking out of their nose or their ears if there's a fracture at the same time. There's something called battle sign where there's a couple of variations of this. One version of battle sign is bruising through the center of the nose if you get clocked really hard in the center of the face. Another one is in the back of the mastoids. If you get hit really hard right back there, you might actually experience a little bit of bruising and tenderness there as well. That's a hard place to break though, but it does happen. Okay, motion, evaluation, cervical and TMJ range of motion. A lot of people will just do neck movements, but also how their jaw moves as well. Upper extremity muscle strength, lower extremity muscle strength, okay, resisting those movements. A detailed neurologic exam is a must, and your differential diagnosis list is scary in these conditions, okay? So a couple of things, subdural and epidural hematomas, you need to be very concerned if they are showing you signs of stroke or vascular damage. Gone right away. Skull fractures. If it's more slowly progressive, the person may have depression, which can coexist. And it's often a sequela of concussions as people will get depressed, but we'll talk more about that. That's where our outpatient medicine can offer more benefit. And they can often have headache disorders, trauma-induced migraines, muscle tension headaches, you name it, they can get it. Special tests, Romberg's, arm out like this, have them move, and they're going to show decreased function overall. But if I was a smart student or a smart doctor, I would just look at this one right here, concussions. Okay. In fact, I'm going to take a picture of that one. That's going to make my Instagram post for today. Concussion. It's just so good for us to review this right here. Concussions. Bam. All right. Head injury. Number 1, brain damage, strong headache. Again, you're not looking for that worst headache of my life because when they say that, then I'm down my stroke pathway. Dizziness. They're irritable. This is a big one. If their mood has changed substantially, this can be associated with that brain trauma that they've had. Temporary amnesia, we've already talked about. Oh, I can't sleep. I just can't get comfortable. Photo or phonophobia. I am extremely sensitive to sound or light. Well, just wait a minute. That kind of looks like a migraine. You could see how you could overlap this concussion-induced migraine into that, and even vomiting in severe cases. Okay. Major red flags for us to be aware of. If we flip over, we have this thing called the Glasgow Coma Scale. So you can look at actually how bad are their symptoms in this traumatic brain injuries. And you're looking for 13 and above, things are probably okay. But as you start to get lower, we are looking in more and more substantial symptoms right there. You're looking for how do they open their eyes, verbal stimulation, how do they respond, right? And obviously, if the person can't open their eyes or giving no verbal response and no motor response, that is not something that we'll typically see in our practices. But again, you can see the changes of that scale right there. Diagnostic imaging is not useful, particularly to diagnose concussion, but it might rule out other pathologies, other brain injuries. But the imaging is just starting. There are some studies out now talking about more detailed triple axes, MRIs and stuff showing us more details of concussion. But again, you'd have to have availability for that actual equipment to be able to show you that. You can grade concussions as mild, moderate, or severe. And the severe is you actually did lose consciousness. The mild, no loss of consciousness. Maybe you were confused for a little bit, but your symptoms are gone within 15 minutes. This person usually is going to be fine. You probably shouldn't complete the event if it involves a lot of contact. Oh, one nasty concussion that I saw. My brother-in-law is the head athletic therapist for the Douglas College there. And one of their girls got smoked with a spike in volleyball. Like it just laid her right out. And she was basically a grade 2. She didn't lose consciousness, but she was like, where am I? Her face was red. She actually bled from her nose a little bit. Like it was just aggressive power hit that blasted her down. So we went through the full rehab there. But anyways, if you get in the more severe injuries, this loss of consciousness that lasted for seconds or minutes, this has to be further evaluated. It is in your best interest to get them into a hospital ER to have a closer look at this, okay? All right, treatment options, what are we looking at right here? 1 to 7 days treatment approach, gradual return to activity, graded exposure, and it doesn't matter what it is, exercise, lights, range of motion, it's all graded exposure that does not aggravate. Subclinical movement. You can look at even because it's an injury to the brain, you're looking at supplements for the brain. So your omega-3 fatty acids, phospholipids, anything like that that can help restore DHA, all that good stuff, okay? Fish oils are going to be huge for these people. What else? Patient education on the pathophysiology, what you expect to happen with this and the potential complications. Educate and empower these people. They can get better, but it's going to take a little bit of time. But there are key things that the research shows will work well for you. Wearing a helmet reduces the risk, okay? Especially for a lot of cyclists and skateboarders, they tend not to want to wear helmets a lot of time. You take a couple cracks on your head and you're going to like to wear a helmet. The big one you're looking at is a standardized assessment concussion score or a sport assessment. The SCAT is what you want to get. But the SCAT pendulum swings every couple of years as they redevelop and modify it. When I was talking with our professional NHL level hockey player teams, they were talking about how most of their players could not pass a SCAT, whether it was because of language issues or even just physical ability to do it. So it winds up being very difficult to use in practical practice, especially if it's super long. But this graphic takes you through the key things for concussion right here. So what do I want to get? My key strategies are clean up the diet. You are trying to reduce inflammation. And there's good research that supports low inflammatory diets reduce the concussion symptoms and improve healing times. But we know that in general. Sub-symptom exercise. That means challenge yourself enough that it doesn't result in the fatigue or headache returning or anything like that. But you do want to try and approach those boundaries. Sleep hygiene is key. A regular sleeping routine, not looking at your phone, getting light stimulation right before you go to sleep. All right. Graded stimuli training, and that can be for anything. That can be for even exposure. For a lot of people, they have to be even put into rooms that have very few pictures, very light movement, right? Community support and counseling are going to be key. And you can look at the key things you want to do here for as far as headache exam, as far as headache, cognitive function, vestibular issues, and mood as well. I would suggest co-management with a counselor is huge. Some kind of sport counselor or a self-help group where people are talking with other people with these concussions that play the same sport or do the same activities. Like if it's firemen who get concussed, say, hey, you should go talk to a bunch of other firemen. Cleaning up the diet, physical activity, graded stimulus, vestibular rehab. Yeah, moving your eyes around. There's all kinds of crazy things you can do that can offer benefit. People will often describe this other term as well, brain fog, kind of a slang term, just slow thinking, slow movement, poor concentration. Okay, all the sensitivity, the neck pain we can definitely help with. Sleep issues we can definitely help with, but that would be my basic run through on it right there. Even cognitive behavioral therapy actually has pretty good outcomes as well, making sure to not overly tax yourself, making too many decisions in one day. You can have changes there. All right, let's go to the chat and see what we have. I had concussions and ended up vomiting multiple times. Yeah. So Taylor, why don't you go ahead and tell us about that?
Yeah, so this story, I was actually in 4th grade, and I was scootering down the hill, and I was without a helmet, and I was like going down. So I was like had a bunch of speed going down the hill, was going around the corner, and I just wiped out. And yeah, I got up. I was like spinning, like someone was talking to me. I didn't know who it was, and I kept walking to school, and I ended up vomiting like in the jacket area.
Yep.
And then I didn't talk to anyone. I just like walked home. It's like a 15-minute walk up the hill. And I saw my parents, and then they immediately took me to the hospital, and I was trying to I wanted to pass out.
Yeah.
But mom was trying to keep me awake till I got there. And yeah, so but I guess I had like a moderate, mild to moderate concussion.
I might even call that moderate to severe right there, because the fact that you vomited, the fact that you want to go to sleep, that's a huge red flag. Your parents did the right thing, trying to keep you cognizant, keep your brain working and moving so you could be there to do a more detailed assessment and evaluation of what's going on. Oftentimes, as the people start to fade away, that sleeping can indicate that epidural or subdural hematoma growing in size, causing more compression, and you're looking for a way to, well, your body's trying to find a natural response to kind of reset the system, basically. Yeah. All right, cool. I'll give you guys my example of it. Kind of a similar story. I was about 8 or 9 years old. I've been concussed before. Well, there's two versions. Maybe that's part of the problem that I've got to deal with here. One of them was playing baseball in high school. So basically I was on second base. I'm like calling for the ball. I'm like, throw. And the guy was going to throw to first. And then he made the motion to throw to first. And I was like, oh, and I dropped my head down. And when I dropped my head down, the ball then came to me ultra fast, hit me in the top of the head. And I didn't fall or anything like that, but I was seeing stars and spots and everything like this. Nothing broke. That would be one example. The other example would be like you as a kid. I was riding my bike, not wearing a helmet, going down a steep hill, getting a lot of speed up. And it was fun to go zzz, zzz, like this back and forth down the hill. And so my front wheels on my bike went straight 90 degrees. I flipped over the handlebars, landed on this area of my eye, and ground my whole face down the hill for I don't know how many meters. It must have been a good, there was a trail. You could see where I hit, and then you could see where the skin came off, and then you could see where the blood started. I got ground down the road there, because I was only wearing a t-shirt, and basically blood in a straight line right off of the ridge of my eye all the way down like this. I don't even remember it. I got up, the same thing. I had to stagger back. It was some kind of birthday party in the summertime. Stagger back to the house, and I get there, and as soon as my mom saw me, she just screamed, because blood, torn up shirt everywhere. It was just terrible. And yeah, so pretty significant concussion right there. That would have been a moderate to severe as well, but it's involving high force, lack of protective gear, treatment. I actually had to get stitches, sutures all the way across my eyelid right here. I can remember afterwards, like a week later, I was out at my dad's place and we were doing a bonfire, roasting some hot dogs and stuff like this. I could not even be close to the fire because my skin was so sensitive from all the healing that was taking place. I couldn't smile because it would crack like the scabs and everything that had formed. Like it was just a nasty, nasty injury. But they are quite common injuries. Christina, why don't you tell us about your injury and what you did for treatment?
My cousin played baseball and we were like, I don't know, 13. And he was just like fucking around with his baseball bat and nailed me right in the head. And then same thing, like I lost balance, fell over.
I'll say one thing about that just before you go into a little bit more. So even for me now, I cannot stand it if someone hits me in the head. Like I literally just go instant anger, super ballistic when it happens. I can remember same kind of thing. We were goofing around. Someone was playing around with a guitar, pretending like they were going to hit me. And then they hit me and I just lost it right after that happened. Like ultra sensitive to any kind of face trauma or head trauma.
And then that's pretty much all I remember. But then afterwards, I remember just getting like super like spastic, sharp headaches in my frontal lobe.
Yep.
For like, I don't know, a couple weeks after that. And then my mom was concerned. So she took me to the doctor and the doctor basically just said like, that was my brain healing itself after the injury.
Yeah, kind of a response. And yeah, that's actually a good point because not everybody heals the same way. So you have to look at a variation of a lot of different symptoms. Some people are going to say, no, I get this pain right in the back of the root of my neck all the time. I get pain in the front, like all of this different stuff. But again, pretty significant injury, but we can do a lot. And I want to stress this again for everybody. You already know this, but the diet and sub-symptom exercise and sleep are the winners right there for this condition. They cannot go back in and play their sport at a high level. You've got to slowly get them to it and make sure to educate them on the process and give them the support they need. The counseling is huge. Cognitive behavioral therapy, graded exertional exposure. Those are going to be the wins for this condition right here. Okay. Lauren, go ahead. Share your statement right here that you just said. Dr. Lauren, what do you got?
So I used to work with a lot of people with post-concussive disorder. And when there was diplopia or ocular motor dysfunction,
Yep.
That paired with special prescriptive glasses that added prism to it, as well as retraining, could help with some of those symptoms to recalibrate their visual system.
Yep.
Yeah.
Well, you don't even realize this. A lot of people won't get it. Even being exposed to a lot of blinking lights, a lot of fast movement, not very good for you. What's better? Go for a walk in a forest. Go for a walk in a field where you're decreasing your visual stimulation and actually getting a little bit more cognitive change because you can actually breathe better. You can reinforce positive movements and then gradually increase your tolerance over time in a more natural environment. Do not just sit in your apartment or lock yourself away in a dark room. Those will be the worst outcomes for you. Anything else, Lauren? Have you seen it go bad before?
The therapy go bad?
Yeah.
I've seen wrong prescriptions, or if someone overdoes it with the therapy, they think more is better, they kind of get into peaking their symptoms, and we need to bring that back down.
Okay, just wait. That is huge what you said right there, because what happens for most athletes, that's exactly what they think. They think more is better and they progress too fast. One of the key things you have to do is make sure they're progressing at a rate that they can maintain rather than overloading themselves and then having a setback.
Exactly. So we try to avoid symptom flare up, just kind of moderate doses of therapy.
Mm-hmm.
Yep.
Yeah. Excellent. All right. Go ahead, Taylor.
Yeah, I just had one other story I wanted to share. Let me just
You can put your hand down. Yeah.
get in there. All right.
Yeah.
Yeah, there was at my university at Bishop's at the time. There was a football player. So he's he was a friend at the time, and he had a concussion during the game. But then they let him back out, and he was one of those guys, kind of like a ladies' man, just get context.
Yeah.
And then now he's mentally challenged and just looks completely different just from that concussion. So it was just crazy. I know it was just a huge shock to everyone, and just hear his story, to go through all that.
Yeah, absolutely. I mean, if you want to even look at it too, if even in prehistory, for people who are famous, who've been studied really well, King Henry VIII is believed to have had the same thing happen to him. When he was younger, he was a same kind of thing, ladies' man, super tall guy, super athletic, and he was doing jousting. And during one jousting tournament, he got rocked and knocked off. And ever since then, everybody commented on how he actually changed, how intolerant he was, how quick to anger he was. All this kind of stuff that changed following the injury, right? And it's sad to see those changes happen. And in a lot of cases, you don't know exactly what region of the brain is going to be damaged. But again, there's still lots we can do to support these people, right? And if the earlier we can get them on the right track, the better off they're going to be. Even for some of my concussion people who have done martial arts, I'm like, hey, come and try some jujitsu. You're going to still be able to move around. You're just not going to get the hard hits that are going to cause exacerbation of symptoms and be at high risk for you. Gentle movements. And that's what you see down here at the bottom, even for the headaches. Acupuncture, yoga, Tai Chi. What is jujitsu? It is forced yoga, basically. So you can still get your athletic edge and kind of go from there. Jen, go ahead.
Yeah, I just had a question, with what Lauren and you were saying, is it that you're doing treatment too much that can exacerbate symptoms?
Yeah.
If you're wearing the glasses for too long?
So this is exactly it. So the whole thing about this is subclinical or subsymptom exposure, right? So we're saying subsymptom exercise, subsymptom, whatever it is, you don't want to reintroduce symptoms. You can a little bit as they get better, but at the very start, you don't want to do that. But what happens for most athletic people once they realize this is a treatment? Like, let's just say that I said neck range of motion is going to be something that's going to help you feel better. If you do it on give a prescription and we see how they tolerate. Well, the first time they do it, they're going to follow your recommendations and then they're going to say, nope, I want more. And they keep on going more and more and more. And then they actually overdo it. The physical act of doing this starts to move their brain around too much and they get their symptoms returning, even though they think this is going to help them. Like a lot of people do this with supplements. I've got one jujitsu guy right now who's doing with ultrasound. He sees me for ultrasound and then he's going to see a physio for ultrasound because he thinks more is better. It's not causing him symptoms. So I'm okay to give him the ultrasound treatments. But what happens for these athletes is they will go so hard because they believe it's going to be better. They'll work their way through the pain thinking it's going to make them better when in fact it's actually delaying their healing. Returning to activity too soon, too aggressively. This is what happened for Eric Lindros and other people who've had these concussions is they come back too soon, too aggressively. Take your time with it.
Okay, right. So like you're wearing the glasses all day, every day, and then you take them off,
Yep.
and then symptoms come back
Now
because you're not.
now your brain is confused because you got to remodel to both of these things. And you should wear them. And again, Dr. Lauren, you can give me a little bit more on this, but I would say you'd start it off like anything. You would say, okay, wear them for 20 minutes. How are you doing? Take them off. Wear them for 30 minutes. How are you doing? Take them off. Like it's got to be graded exposure is what you're looking at.
Yeah, so initially the glasses, some people would find it was too much of a change too quickly, so they would do the graded exposure. But once they got used to it, it was more preferable for them to keep it on. Because they've adapted to it and it improved their gait. So there was a bit of a transition period, and depending on how sensitive someone was, that could be longer or shorter.
Absolutely. And then that's going to be on an individual basis too. You don't know that this is going to work for one person or work for the next person. You've got this picture that I'm showing you guys right here. There is a multifactorial approach to this that is likely going to have a few key things that work well for that person. And that's where they should spend their time.